Hello and welcome to Health Matters on Channels Television again. Thanks for staying with us. I am Mary Alale Yusuf. Adult teeth should grow at the right angle and with the right spacing, but sometimes they don't. A group of problems like this causes malocclusion, which is Latin for bad bite. Sometimes children suffer image problems and teasing because of misaligned teeth. The bad bite is not a disease, but a set of dental deviations. Treatment is usually justified by the expected improvement in social and psychological well-being caused by a better appearance. There is no generally accepted method for determining the prevalence of malocclusion, but results range from 20 to 80% of the population. My guest is Dr. Gerald Isiekwe. Dr. Isiekwe is a consultant orthodontist at the Lagos University Teaching Hospital and a senior lecturer in orthodontics at the College of Medicine, University of Lagos. You are welcome to the show.
Thank you very much, Mary.
Okay, let's start right off. Can you just give us a description of what malocclusion or the bad bite might look like?
Well, trying to say it in the simplest ways possible, malocclusion is a technical term that describes crowded, protruded, or irregularly arranged teeth in the jaws that affects the facial appearance and also affects the facial appearance. So it's an abnormality in the way the teeth are arranged, in the way the jaws are related, an abnormality that also affects the way the facial appearance of the patient.
Why would a person have such teeth? People are expected to have straight, beautiful white teeth, lovely smile.
Yes, that's the ideal. But just like the terms, like you rightly said in your intro, it's a deviation from normal. The commonest cause is hereditary. Most people tend to inherit the kind of, not just the facial appearance, but the dental appearance that they have or dental arrangement that they have. And so you have a mother who has a gap teeth, and you say this gap teeth runs in the family. Or
we like those.
Yes. And then you have crowded teeth that tends to run, or protrusive teeth, and it tends to heredity. Heredity is one of the, or genetic linkage, I would like to say, is a major cause of malocclusion. There are also other causes. If in a child or in an adult, if there's premature loss of the teeth in a child, as the child tends to lose her baby teeth before the time that particular teeth was to fall off, and it's not well managed, it could result in malocclusion. Same thing for an adult. Oral habits is a very common cause also for malocclusion. Trauma.
Sucking?
Yes, when I say oral habits, yes. Sucking the finger, I mean, the thumb sucking that we commonly see in children, thumb or digit sucking.
Or
pacifier.
Whole
yes.
hand sucking.
Yes.
Some children do that.
Yes, it will amaze you the different types of, sucking habits that can exist, and that can cause it. Some diseases of the jaws can actually affect the way the teeth are arranged. So there are a whole number of causes, hereditary and acquired.
Okay, you've spoken about crowded teeth and other type of teeth. How about the gum itself? Is there a situation where the teeth can be rightly formed, come out properly, but it's the gum that is now pushing out? Because, you know, as a person who is not a doctor, sometimes it looks like that to me, that the gum is, how do I put it, puckered out and gives the person an appearance that the teeth are pushing out of the mouth. Is that possible?
It is. Well, in this case, it's not just actually the gum, but actually the bone on which the teeth are resting. The bone on which the teeth are resting, because the teeth rest on what we call the basal bones, the mandible and the maxilla. So those jaw bones may actually jut out, maybe the lower jawbone jutting out or the top jawbone. They are not related properly, and so it will give that appearance that the teeth are straight, but like you use the term the gum, I would rightly say that the bone, the mandible and the mandible maxilla, that's the bones that house the teeth, because the teeth rest on the bone, are not properly related to one another, and it has that appearance.
Okay, we just saw a picture now. This is a picture of crowded teeth. Yes. What do you do with teeth like this to make, this looks like a lost cause. What do you do with teeth like this to make them? Well,
to start with, it's not a lost cause. Patients like this can benefit from orthodontic treatment, fixed appliance therapy. What happens for this particular patient, patient has severe crowding, meaning that the space in the jaws are not enough for the teeth, so they all appear cramped together. We would give the patient a fixed appliance, but we'll need to create space.
What is a fixed appliance?
Well, a fixed appliance is what people commonly refer to as braces.
Okay, those metal things.
The metal things that we put in the patient's mouth. It's commonly referred to as braces. Yes, that's
so
a picture of it.
Braces.
So that's the patient set up with braces.
The same person set up with these braces.
That's the same patient set up with braces, but we've also, because she doesn't have enough space in the mouth, sometimes we want to create space to align the teeth. And so in this particular case, we have to take out 4 teeth behind, not in front.
Does that mean she does not end up with 32 teeth as an adult at the end of the day?
No, she doesn't, but nobody knows. And nobody goes around counting the number of teeth.
But they do look at the fullness of the mouth.
Oh yes, but it doesn't affect the fullness of the mouth. That's why it's a science. It's something that has been studied, and they found out that there are particular teeth that may be missing in the mouth.
Is that the same girl?
That's the same girl after 6 months of treatment.
I need to know what is happening here. The teeth are now straight.
Yes.
Is some sort of thing you attach to the brace, or is it just the weight of the brace that is working on these teeth?
Well, the science behind it all is that you have brackets on the teeth, and then you have the arch wire, the wire that runs across it.
Okay, I assume the bracket is that squarish thing.
The squarish thing on each tooth, it's called the bracket. And then you have the arch wire, that's the metal that seems to run across it.
Okay.
And for this particular type of fixed appliance system that she's wearing, each bracket has a programmed, we like call it a force, to put it in simplest terms, force that will position the tooth in the right place.
Is the force the weight?
The weight, yes.
On the metal?
It is the weight on the metal.
And this is the same girl?
And that is the same girl. After about 18 months of treatment.
She has straight teeth now?
Yes, she has straight teeth
Beautiful straight teeth?
Yes.
When do you start putting these appliances? At what age is it allowed?
Well, treatment can start early. There's no fixed, there's something we call early orthodontic treatment for severe cases in children who are just maybe like 6 or 7, where possibly the teeth are really protrusive. And then treatment can start in adulthood. Sometimes it depends on the patient.
Oh, you can do this to adults?
Oh, definitely. There's no age. Everybody can get orthodontic treatment, provided the patient does not have any severe condition affecting the bones that support the teeth, or any medical condition that may affect treatment, which are very few.
Okay, is there an age at which the teeth won't respond anymore?
There's no age at which the teeth will not. You can actually treat an 80-year-old lady, provided her teeth are not shaking, she's in good, what I would say, periodontal health, means that her gum is healthy, the bones, yes, she can get braces. There's no age limit to getting braces. And so we see that more and more adult patients are coming to get treatment because there's increased awareness that adults also can get braces, not just kids, not just children.
Okay, now, obviously, putting braces will affect how a person looks.
Oh.
But if a person has maybe overcrowded teeth or scanty teeth, does it affect speech?
Yes, the way, one of the problems that can occur from, like your intro, can occur from malocclusion or badly arranged teeth is that it can affect your speech. Patients that have, for instance, a gap between the 2 top teeth, where their 2 front teeth don't meet, we call that an anterior open bite. We notice that they may have a lisp, and they may be unable to pronounce certain words that require the tongue making contact with both teeth.
Okay, in that case, it would be a person whose teeth are not touching.
Yes.
And you have those people whose teeth don't meet.
Yes, in front, yes.
Why would the teeth not meet? Okay, the teeth have fully grown.
Yes, they're fully grown.
Yet they are not meeting.
What's happened? You know, we talked about habits. And the commonest cause of that in adulthood is oral habits. If you have a child who was sucking for a very long period of time, beyond the accepted age of about 4, up to 8, up to maybe, high intensity sucking, that child was actually sucking actively, yes, it would affect the way the teeth appear, and you will see that appearance persists till adulthood, and you would have the gap between the teeth. There are other causes also, though. There may be skeletal causes, from the bone.
We'll come back to that. We really need to take a break now, but when we come back, we'll come back to all these teeth. Please stay with us. We're going for 1 minute, and we'll be back in no time.